It's behaving in the way that we would expect it to behave.
Tonight, a message from the chief medical officer at one of the largest hospital groups in East Tennessee. Omicron is here, but it's not as bad as the previous variants. This is a little more than 60% of people in Knox County who are eligible are fully vaccinated against the virus. Most are age 50 and older. And 10 News reporter Vinay Simlot spoke to the Covenant Health CMO about where we stand now and what he expects moving forward. Vinay?
John, this is a map of hospitalizations in Tennessee, and you can start to see them tick up and quickly over the last week. But Dr. Brown says he doesn't expect it to be as bad as the previous variants because the virus is mutating.
It becomes more contagious and less virulent, or makes you less sick.
That's the difference between the new variant and old ones. Dr. Mark Brown, the chief medical officer for Covenant Health, says he's seen the evidence on the variant around the world.
They never saw the huge spike in hospitalizations, and they never saw the huge increase in deaths from the disease.
With caveats, Omicron is still dangerous for people who have underlying illnesses, immune deficiencies, or who are unvaccinated. Statewide, the Department of Health is reporting more hospitalizations for kids, but the East Tennessee Children's Hospital says they only have one patient hospitalized and tested positive for COVID-19. For this variant, 2 of the 3 monoclonal antibody treatments already approved don't work. Those treatments are for people who are already infected.
We are beginning to see the percentage of Omicron in our community go up, and across the country as well. So they're no longer available to use.
He says the best bet is still the vaccine.
The more vaccinated you are, if you will, the shorter your symptoms seem to be, particularly with Omicron.
He's also okay with new guidance from the CDC that says positive COVID patients can stop isolating after 5 days.
Are you comfortable with what they have asked people to do?
I'm comfortable because the science shows, again, particularly in people who've been previously exposed or vaccinated or have some level of immunity, that if they get Omicron, they don't shed the virus quite as long.
So that doctor reminds everyone, John, we are very much in winter and respiratory viruses peak during this time. So please get your COVID vaccine and the flu vaccine, John.
Vinay Simlot with the very latest. Thank you, Vinay.